This segment of DelmarvaLife is brought to you by Peninsula Home Care.
Consider this. More than 65 million Americans rely on Medicare for their health care needs. Now, when you do the math, that's almost 20% of the U.S. population. But the details of Medicare, it's many components, and it can get confusing, and that's before we bring Medicare Advantage plans. So let's try to clear some of this up. With me this afternoon is Beverly White. She is the director of Peninsula Home Care, Maryland and Delaware, along with Ashley Smith, a nurse clinical liaison. Thank you both for being here this afternoon. Okay, so let's just start with the basics. What exactly is Medicare used for?
So yes, when many are turning close to 65 or have turned 65 and they enroll for their Medicare benefits, people are most traditionally know of Part A and Part B, which Part A is generally for, it pays for home care services, but also when you're in the hospital. Part B pays for things like your physician, outpatient rehabilitation, if you go to outpatient physical therapy. And then Part D is a medication plan, if you have a pharmacy plan in that.
Okay, we're missing a letter there. Tell us about Part C.
So a few years back, they added a Part C, which allowed some of our managed care organizations or other commercial insurance carriers to opt into providing a Medicare plan, what they considered a Medicare Advantage plan, and that's what is Part C.
Okay, all right. So Peninsula Home Care actually helps folks, I guess, kind of choose what's best for them. How do you do that?
So we just try to inform patients to make the best decision when choosing between a Medicare plan and a Medicare Advantage plan. We also are partners with the Max Center, who helps with wonderful resource for patients to help them decide between Medicare and Medicare Advantage.
Yeah. And you have a very important date coming up as far as changing your plan or signing up?
Yes, so the Medicare enrollment period begins on the 15th of this month, and it runs through the first week of December. During this time, you have to elect what benefits you're going to be enrolled for as of January the 1st for 2024. After you make that decision, you are no longer able to make changes to your decision until the next enrollment period, which wouldn't be until March. And then after that, you have to wait again for the remainder of the year. So that's why we really encourage our patients to choose wisely, because you're going to have this plan for the entire year, whether it benefits or not.
We talk about this a lot, and I find it confusing. I imagine patients find it confusing. What are some of the things that could happen if they don't choose the right plans?
So for Medicare Advantage, your plans for that are geared towards primarily healthy people. If you're healthy, if you're in good health, then maybe an Advantage plan might be okay for you. But Medicare is going to be your best option. It's going to pay for your doctor's visits. It's going to pay for your hospital stays. It's going to pay for your rehabilitation stays. I'm seeing that a lot of the Medicare Advantage plans that people have when they're in the hospital, if they need extra care after being discharged, they're not always going to be accepted at a facility that's going to accept that insurance, which is, it's really, it's terrible. But so we call them disadvantage plans, because you're at a disadvantage if you have Medicare Advantage because of the restrictions that they have on those plans.
Yeah, and there's restrictions on supplies as well, right?
Yes, so we've had some patients that don't realize, they think there's a savings, and that's how it's advertised to them, that some of the plans are offering a savings in your premium. However, what they don't tell you is that if you're a patient that often needs wound care, if you are an ostomy patient that you need ostomy supplies, and most people buy those every month, they will only pay for a certain type. And it may not be the one that is easiest for you to use, and then you have a copay to pay for that. Some of the supplies for home care, we have a limitation that you may only get basic supplies, but not a supply that may actually help your wound heal faster. Medicare, traditional Medicare will cover that, your Part A. A Medicare Advantage plan will not. So people don't realize that. Same for when they're in a facility. A Medicare A patient may be able to go to a facility for 20 days and then go home. We're finding that many of our patients with one of the Advantage plans are only able to stay for 5 days, and then after that they either pay a copay or go home. And sometimes that's premature for them.
Sure. Well, the good news is, like you said, you have a partnership with MAC,
Yes.
Agency on Aging,
Yes.
and they can help folks figure out what's best for them.
Yes.
Yes.
Yeah, our biggest message is just know what you're choosing. Take the time to be educated and make a good choice. And if for some reason you aren't happy with your choice in January, you do always have March to be able to make an additional change for next year.
All right,
Yes.
Beverly White, Ashley Smith from Peninsula Home Care. Thank you so much for coming in.
Yeah, thank you for having us.
October 15th, that's when you can change your plan.